Namaste, Vanakkam, Swagatam.
Namaste, namaste.
Just organizing for Devasana's Zoom on the other computer because she was going to go to town, but the traffic is so bad. So decided to do her class online for the Yoga Anjali. I was listening to the conversation a bit, and I think one factor that needs to be brought into all of this yama niyama, putting it into person's day-to-day life is one has to understand the cultural context very clearly. So, uh, what happened when the Yama Niyama were first introduced in the West is the moment people saw 5 plus 5 is equal to 10, they said, oh no, another 10 commandments. And this actually became a problem with Yama Niyama. The reason Yama Niyama is not discussed in most modern yoga circles or kept at the periphery or mentioned in the passing is that they said, oh my God, another set of rules that somebody has given us. So I think the most important thing with Yama Niyama is to remember that the Yama Niyama are not there for us to beat somebody. They are not a stick with which to beat somebody, saying you are not following the Yama Niyama, you are not following Satya, you are not following Ahimsa. They are a yardstick for personal spiritual growth. So they are only for our own personal growth. They are not for comparison. One person is better at ahimsa than somebody else. Somebody is more satya than another. Because this is how people have propagated it in a totally inappropriate way. And that is where then confusions come. And I was thinking, you were talking of aparigraha. And parigraha means to grasp. Parigraha means to grasp. In fact, there is an asana, pariga asana, which means a hinge, because the hinge helps the window to grasp, the door to grasp. So parigraha, graha means to hold. To hold. Parigraha is to hold on to something. Aparigraha is not to hold on to something. So to ask the person to question, what are they holding on to? So it is not even about things. See, it's easy to say that, okay, look at things. It's about what are you holding on to, or what is it that is holding you? And how can you move from grasping to non-grasping? This is actually what aparigraha is. And this is where I think another way to understand aparigraha is minimalistic living, which is a more modern concept that what do you need to live? The minimum you need to live, keep that. Don't go for extravagance. Don't go for unnecessary stuff. And don't stuff yourself. Again, be it with food, be it with things, be it with emotions, be it with people. Don't stuff yourself, because you are stuffing yourself and you suffer indigestion. So I think if we understand in this context, from a therapeutic point for me, I think trying to help the person understand what is it they are holding on to and how they can release it. And that is where in our jatis we do shake and throw. It is a physical releasing that says, I don't want to hold on. I want to let go. And that letting go is the most important component, because if you don't let go, you cannot relax. If you cannot relax, you cannot heal. If you're not healing, then I don't know why you're wasting time on yoga chikitsa. It's as simple as that. So the whole thing boils down to this tendency to grasp, and this is very primitive. Very primitive. A newborn baby, one of the first reflexes is the grasping reflex. And the pediatrician comes into the neonatal ward and puts the finger into the side of the palm, and the baby grasps. And the pediatrician says, yes, this will be a good human being. They are neurologically competent to survive because they can grasp. And this goes back to the time we were monkeys and we needed to grasp onto the branch so that we don't fall. See, all of these are very primitive. So what is yoga doing? It is trying to work against the primitive tendencies, enhance the more evolved, conscious, mindful capabilities. And that is where this journey. And if, because again, I was discussing with my daughter about it because we were looking at a chapter on frustration. Because frustration is a very important aspect of behind aggression. And frustration and prejudice again go together. But we were talking of frustration. Somebody is in a house, they are very, very happy with being in that house, okay? They have, a bedroom and they have a kitchen and they have a hall and 1 BHK, we call it here. And, they're happy. They're happy. And then what happens is next to them, somebody builds a bigger house who has 3 bedrooms, hall and kitchen, and a car parking. And now this person who was so happy, contented, has become discontent and frustrated because now they have started comparing their house, with which they were happy, with somebody else's house, and that makes them unhappy. And this is why it is rightly said, comparison is the thief of happiness or the thief of joy. Because we always do this. And that is why not comparing and developing santosha. That is why santosha, which is a niyama, is like a support system for aparigraha. Because the more you have santosha, the less parigraha will be there. So they support each other. You will find there's a cross current. I think my Adhikara Yoga course is free on YouTube. I uploaded the videos there. I will see if I can find them. They have gone into a whole set of, I think, 6 or 7 classes on just the Yama Niyama, where we went into each one. They feed each other. So I think if we realize that how they feed each other, we can help people see the connection in their life. And then it is up to them to bring about the changes. What they want to throw out, whether they want to throw out the bed or whether they want to throw out the husband, that is their business. But, you have to help them know what is possible and then give them the choice. So that just came out of listening to all of you. My plan for today is that I wanted to just give you a quick overview of the 12 diagnostic tools. Not go into too much detail because when you go to level 2, that is expanded. And if you do come to the ashram, which I highly recommend, you then are going to hear this and understand it in a much more deeper way. But for now, I just wanted to share some interesting aspects, this 12 diagnostic tools or assessment tools, because some countries, they don't like non-medical people to do diagnosis. So they call them assessment. It is an evaluation tool, Dwa Dasha. Dwa is 2, Dasha is 10. So 12. Roga means the disease, Lakshana characteristics. So Anukrama is a procedure or a methodology to analyze and understand the characteristics of disease through 12 points. So a 12-point evaluation system that Swamiji developed. And this was a PPT prepared by one of my students at SBV. And I still cannot make a better one. So I keep on using it and giving her credit because she did such a good job. Not going to go into all of this. We have all discussed this. But I wanted to come back to, this is the main one which we wanted to work on. So when we look at the 12-point system of diagnosis and health evaluation, again, please note it's a yogic diagnosis. It's not a medical diagnosis. So the main pushback against yoga therapists doing diagnosis in the West was the medical personnel don't want yoga therapists diagnosing somebody with hypertension, cancer, asthma, which is quite understandable. That is absolutely understandable, but there's no reason you cannot make a yoga diagnosis. And that is why for me, this yoga diagnosis is essential, because your therapeutic plan is going to be based on the yoga diagnosis, not the modern medical diagnosis. You are not giving yoga therapy for somebody else's diagnosis. Now, you may have to explain it in ways that a medical professional will understand by using that diagnosis that they have given and find that cross connections. So when I talk to the doctors and they say, I've sent a patient with diabetes with, neuropathy, and, the blood glucose levels over 3 months, the glycosylated hemoglobin is way beyond what we want it to be. I will talk that language to the medical professional, but I am not giving yoga for diabetes. I make an assessment of the individual. I try to understand these 12 points and how that person can be approached through this, create my own yoga diagnosis, for which then I create my own yoga therapy protocol and I apply that protocol. But if I, say here we have the prana. So say I talk to the medical doctor and says, of the prana, the Vyana is not working properly and Samana is a bit hyperactive. So I'm giving yoga practice. That doctor is going to go mad, because he'll say, what mumbo jumbo are you talking about? So when I talk to the doctor, I say I'm going to give them practices that are going to help utilize the glucose that is stagnating in the blood, work on enhancing the liver health so that glucose is converted to glycogen, help the muscles take up the glucose better, give them changes in the diet to reduce the simple sugars that are there, give them a healthy breath and relaxation protocol to reduce the stress, because stress aggravates blood sugar. This is how I talk to the medical professional. But my yogic diagnosis and evaluation is what is guiding my therapeutic protocol. And that is why no two patients are the same. No two individuals are the same. So you will have similarities. And what we find, in fact, is, interestingly, I try to, for practical purposes, club people together in sessions who may not have the same medical diagnosis, but the yoga diagnosis is in the similar line, hence similar practices can be given. So if I have 2 or 3 people for whom I need to do the Pavana Mukta Asana series, I can club them together irrespective of whether they have hypertension, diabetes, asthma, or any other condition. So in this 12 point, the first one is the 3 gunas. And this is an essential starting point, because the gunas and the second one, the doshas, will for most part determine the practices you are going to choose for that individual. So if somebody is very tamasic, I hope, Jnanadev, that the gunas have been covered and they understand the gunas. Otherwise, I'll be here for 2 hours on that. That's one of my favorite topics. So we have the tamo guna, the tamasika guna, which is very, very dull and inert. So if you find that this individual is very dull, they don't want to make effort, there's a lot of stagnation in their life. Now, that is a tamasika guna predominance. You may find the person is very rajasic. They are constantly busy. They are too busy doing nothing. That is rajasic. They're running around burning the candle at both ends. There's a lot of rajas. Rajas is usually a lot of stress also. Stress, anxiety is a lot of rajas. That rajas burns them up, and then they come into tamas and end up with depression. Depression is having more a tamasika quality. Anxiety, mania is more rajasic. Now, sattvic is normally not really pathological, but I say that some people have pathological goodness. They are too good for their own sake. And these are the people who get swindled by others, who get cheated by others, because they are just too nice a person to say no. And there you will find that there is a sattva predominance, but because of that sattva, they are actually harming themselves. And this is often happening with people who care for others. They care so much, they serve with a noble intention, and then they end up with what we call wounded healer syndrome. So, what we understand is that sometimes these people have to come back to reality and realize that if you do not give self-care, you cannot care for anybody else. So, though sattva itself cannot be pathological, the sattva guna in the modern life may make you a target for unscrupulous elements who take advantage of you. And so the person may have to develop defense systems. They may have to learn how to say no. They may have to learn how to take a holiday and not burn themselves out because, they're trying to be good and take on everybody else's job. You do your job. Don't worry about others' jobs. So they have to have that. The three doshas, here the vata, pitta, and the kapha. So whether the person has a vata predominance, a pitta predominance, a kapha predominance, or a combination, there are 7 prakriti, 7 combinations that are possible. Vata, pitta, kapha separately, vata, kapha, vata, pitta, pitta, kapha, and vata, pitta, kapha. There are 7 prakriti combinations of the 3. Because here we have to understand what is that person's prakriti, which is that person's essential nature. And then what is the vikriti, which is the deviation from the nature that has caused the disease. And so you may have somebody who is by nature very sattvic, but there has been a vikriti and has gone into tamasika guna. Because of being so good, they are not allowed to be good, and so they have become depressed. So they are sattvika prakriti, they have become a vikriti of tamasika, and now you are not to treat the sattvika, you have to first treat the tamasika, because the vikriti has to be corrected first. Now this is a very, very thin line, and lot of discussions can be there. Gyanadev and Anandi have developed some nice questionnaires on prakriti, vikriti and all, which are very useful. But primarily the question here, how I ask myself in simplistic terms is, what is the person's nature? How has it been distorted? The nature of the person is the prakriti, vata, pitta, kapha and its combination. The distortions that are more recent addition. So somebody who could sleep well, if you can sleep well, usually it's a nice tamasika quality. Because you can sleep well without having to get disturbed. It's a very nice and tamasic. But recently has not been able to sleep and having lot of getting up in the middle of the night and agitations, and they get up in the morning feeling more tired than when they went to bed. That means now there is a rajasika element, which is a vikriti element, has come on to that tamasika prakriti. And this is where you have to try to find what is the person's nature and how has it been altered, causing the distress. They have come to you for help because they are having distress. So the distressing factor is usually the prakriti, the vikriti. The base on which the distress is occurring is the prakriti. So these first 2, and I tell you, just to even understand the guna and the dosha and try to know where we are can take a lifetime. And 30 years of working on these, and every day I learn something new about it. So you'll keep on learning, because it is not something you read once in a lesson and you know perfectly. It doesn't happen. There are so many dimensions. There are so many layers of the gunas. There are layers of the doshas. Then we come to the vasanas, which are our psychological background. In fact, the other day in our Vibhudipada Yoga Sutra, we went into a big discussion, thanks to a question from Joseph on samskara and vasana. It was a beautiful discussion. Vasanas are our psychological background. What are the tendencies? What are the factors that motivate this person? What are the factors that hinder the person? What are those vanities? Swamiji used to call them the vanities, the hang-ups. Are they your body hang-ups? Deha, vasana. Are they your society-based, loka vasana? Or are they jnana vasana because of your so-called thinking you know? There are so many people, they come to doctors and the doctors give up on them because they don't even want the doctor to diagnose them. They come and they give their own diagnosis. And nowadays we say because of Google and Wikipedia, the patients come in with a decision that they know more than the doctor, and you cannot deal with it. It's very difficult because they know so much. It's a jnana vasana. And trying to get them out of it is very difficult, very difficult. I have dealt with some astonishing individuals over 30 years in this. And you keep on trying to find new ways to deal with it. What are the vasanas? What is driving? Recently, I have tried to use the term, what are the internal drivers? What is driving that person? Because if you can tap into that, the negative drivers you have to eliminate and the positive drivers you have to use to support your yoga chikitsa protocol. And this is very important that we go into the vasana. Then the prana, the energy flows. There are 5 major energy flows. There are 5 minor energy flows. The major energy flows are physiological functions. So we want to understand, is the respiration impacted, which is prana? Is the elimination impacted, which is apana? Is the circulation impacted, which is vyana? Is the communication impacted, which is udana? Or is the digestion impacted, which is the samana? Prana, apana, udana, vyana, and samana. And this is one of the key aspects. If you ask me, to be frank, I would say that just the prana, if you can analyze the prana functionality and malfunctionality, you can be a good yoga therapist. Even if you just know that, because that itself gives you a key, because the energy, when it flows normally, health is there. When the energy is abnormal, either it is above normal or below normal. So this above normal is called atijirana. Below normal is called ajirana. Now they say jirana is digestion, but the same thing, metabolism. Metabolism is jirana. So atijiranatvam is when you have hyper functioning. So if a prana is hyper functioning, for example, if the prana in the heart region, which drives respiration, if it is hyperfunctionality, you may develop allergies. And there may be this, excessive push on the respiratory system. In the heart, it could be an excessive push on the cardiovascular system leading to hypertension. So an excessive push of the prana in the heart region leads to a hyperfunction. A hyperfunction is when there is not enough prana. So you're not breathing properly. Your heart is not pumping properly. And that is why sama is where we want to be. Samajirana is where we want to be. Not atijirana, not ajirana. Samajirana. Sama means balance. You want that balance. It is said again with the Agni is the same thing they say. Tikshna Agni and Manda Agni and Sama Agni. This is another word that comes with the fires, the metabolic fires that Ayurveda talks about. And Yoga Chikitsa Ayurveda have a lot of commonalities. So the pranic flow, again, with the minor energies, they are all protective energies. So is the person constantly sneezing? Are they constantly yawning? Are they constantly belching? Are the eyes, you meet people and they keep on blinking. There's a hyperactivity that is happening. So these are the minor pranas. So when you notice this, instead of saying that, this person is, complaining of belching and burping, you would say this is the Naga Upapranavayu dysfunction. That is the yogic terminology. Then it becomes yoga chikitsa. If you say there's belching and burping, it is a medical terminology. But I'm giving you a clue how you have to translate this and find the cross associations. If somebody is having excessive sneezing, it is the krikara. The Krikara Upaprana Vayu is hyperactive. And there you have to try to bring that hyperactivity down. The next part after Guna, in fact, I often tell the story that I had a intern from Australia with us at ISCM. And she was trained in a different tradition, already practicing yoga therapy, but came for an internship for 3 months because she wanted to experience the work in a clinical setting. Because we are, I think, one of the rarest hospitals in the whole world where yoga therapists and music therapists can go to any part of the hospital at any time of day and have access to the patients who are there. It is rare. I had a team from Paris with me yesterday, and they couldn't believe what we were doing. They said back in Paris in our hospital, I don't think this would even be possible. We can go into intensive care, we can go into labor room, we can go into post-op, pre-op, we go into surgical OTs where our music therapists give music therapy while the operation is going on. In the labor room, the music therapist is giving music therapy as the woman is delivering. As the suturing is done, the episiotomy suturing is done, they're giving music therapy, and you find the pain threshold goes down in women who are having the music therapy. It was one of our master's dissertations 3 months ago. This is the type of thing. So, I really advise people that take 3 months out of your life and come down to Pondicherry and have this, because you cannot buy it. I tell you, you cannot buy it. I had a big problem with yoga therapy trainings. And when Jnanadev and I have been discussing all these trainings, this is something that always is in the back of my head. Because until and unless you work with real human beings, you cannot learn yoga therapy. You can attend online courses, you can attend in-person courses, you can read books, you can watch videos, you can write assignments. But until and unless you really work with somebody, which is why last time we suggested some case studies, that people should at least work with some clients or patients and develop case studies. But again, if you're not able to find it, there's always a place in Pondicherry. Now, Amba or Eli, she liked the name Amba, so she took it up. Ellen Nash. And she is now on the committee of the Australian Association of Yoga Therapists. She came down and she worked for 3 months. She said, I just want to work with patients who have had head injury and trauma. She said, I want to work with neurosurgery. And so our neurosurgery department said, good, come and tell us what you want to do. And she went and she convinced them. And so she would go in the morning to the outpatient department, sit with the doctor as they examine the patient. Patients who were admitted, she would go to the ward and work with them. And astonishing, magical results came out of it. In fact, the neurosurgeons couldn't believe what she was doing. Even I find it difficult, where a person who had lost the capacity to speak started speaking because of her efforts. A person who couldn't walk started walking because of her efforts, all within 10 days to 2 weeks, which was astonishing what she was doing. And she would just go and I think nag them. She had this, that capacity to not let go. And the guy who spoke, because when she went there and she said, come on, open your mouth and go, ah. He's like saying, I cannot. And people around him, his caretakers were saying, no, he cannot speak. And the nurses were saying, no, he cannot speak. And she said, I know he cannot speak, but make that sound. Ah. And finally, she got him doing ah, e, Brahma Mudra and all. And he started speaking again. And when we asked him, what got you speaking? He said, this white lady kept on say, until I had no choice but to start doing it. In a very, very pleasant way, he said it. Now, not, it was amazing. There was another guy who they were having trouble getting him to walk. I think he developed a crush on her and he started walking because he knew that if he held on to her, he could get to the end of the room and also hold on to this nice Australian woman. Huh? Well, anything that gets them walking, at the end of 2 weeks, he is walking. See, this is the impact. So I had a talk with her. She, at the end of 3 months, gave the most amazing summary of her work in neurosurgery. Too bad she didn't have the academic flair. I kept on telling her, write it up, but people have their own specialities, and she didn't want to do that. I asked her, I said, this 12-point diagnosis. She said, I don't care about your 12-point diagnosis. She said, I love it, I respect it and all. She said, all I need is the first one, 3 gunas. She said, all I need is to understand whether the person is Rajasika, Tamasika, Satvika, and the combinations that are there. That guides me to give the yoga therapy I need to give the person. And this is why I stated, not to say you don't need the 12, but she had found that one tool gave her a glimpse into the individual and gave her the capacity to create a protocol. And it was effective, which is why I couldn't argue with her, because she was successful. She was effective. If somebody is not effective, then you can argue with them. But when they are effective, and that is why I always quote Ellen Nash Amba, which was just astonishing. Her dedication, quite amazing. Abhyasa. Here we need to understand what is the personal discipline of the individual. Do they have enough discipline to go through your yoga chikitsa? Because otherwise what's going to happen is you make this beautiful plan and they do nothing. Huh? So 3 months down the line, your plan is still on the paper. This is why you have to understand what type of abhyasa is there, what type of discipline is there. Can you motivate them to be disciplined? Can you work it into the lifestyle? And that is why I always bring this discipline and the jiva karma, the lifestyle, together. Because in the jiva karma, which is your lifestyle, what time do you get up in the morning? What do you do? At what time do you have your food? Do you walk around, or do you take the steps, or do you take the elevator? Do you cycle or go by your bike? Or do you go by your car, to the neighbor's house? This is important to know that. And you tie it into it. Because this is something which I have brought a lot into my work, because one of the major groups I have worked with over the last 30 years is middle-aged women who have a lot of issues with the partners, with the children, have come to a point where life is very dull, depressing, lack motivation, develop joint pains, diabetes, hypertension, insomnia, stress, depression is a major one. And they come to me. Now, if I tell them, get up in the morning and do the yoga, they say, Dr. Ananda, in the morning I have to get up at 5 to clean the house, put the column, our decorations outside, the rangoli outside my house. I have to cook breakfast and lunch so that my husband, when he goes to work, can take his packed lunch. I have to cook the lunch and the breakfast for my kid. So the kid and the husband have to have breakfast either there or packed breakfast and lunch. I have to get all the clothes ready in the morning. I have to, do my morning puja. There is no way before 9 o'clock I can do anything until my husband leaves the house to go to work. My kid gets off to school. That is the only time. So if you say, get up in the morning and do 1 hour hatha yoga, they say, I cannot. We have to understand that. We cannot say, oh, no, you have to give up on your husband. Let him cook his own breakfast. See, she has a certain lifestyle. Now, the next question, I say, okay, fine. What do you do after that? Well, around 9 o'clock, I put on the television and watch what's on the television. And I say, okay, now we have the window. And I say, then what is the next thing? She says, well, around 1 o'clock, my daughter who's in university comes home and She comes home and we have lunch together. I say, okay, fine. I say, now you have a window. Why don't at 10 to 11, we set up a session at Yoga Anjali. You come by 9:30 and you go by 10:30, sorry, 11:15 or 11:30. You take 2 hours out of that time of watching television and come to the yoga class. I'm not saying daily, on Tuesday and Thursday. They say, yeah, that I can do that. And today I have many dozens of women who are coming on a regular basis on Tuesday and Thursday for the women's class. And this has become their lifeline. They come and they have the yoga kitty party. They all come and they have a beautiful discussion. I ask Lalita, my sister-in-law, who teaches the class at the center, I say, what time is the class? She says it's from 10 to 11, but all of them show up by 9:15. And for 45 minutes, they have this huge group discussion. 10 to 11 we do, and then till 12 o'clock, they are all having another group discussion. And they have created this beautiful community where all these women share how they are managing their lives, how yoga is helping them, and create a positive support group. And I tell you, the impact in the past 30 years of this women's group is astonishing. For Amma's birthday, 25 of them came and gave an amazing yoga demonstration. For our 50th anniversary, there were 30 of them together doing an amazing demonstration of the woman power. You have to find where you can fit it in. The other thing I do is I say, okay, fine. In the evenings, what do you do? Can you do something in the evening? Can you go for a walk? No time. Morning is out of the question. Evening? No, I'm busy. I have to go to the temple. I said, great. You are going to the temple. That is very nice. Our Indian temples usually are quite big, especially in the south. We have big temples. So I say, okay, you go to the temple. And normally in the temples here, the person is supposed to go clockwise around the main shrine. And they go 3 times clockwise. It's called pradakshina. And it is supposed to give you a lot of good merit, punya. You develop good karma. So what I say, you go to the temple? Yes. Do you do pradakshina? Yes. I say, instead of 3, can you do 9 rounds? Okay. I say, see, God will also be more happy with you because you have now done 9 instead of 3. You have to speak the language. So now you have done 9 instead of 3, and you are going to get your evening walk. So if you tell her, go for a walk, she says, I cannot. But if you build it into her temple going life pattern, this is where you have to find where you can build this into their life. Because if you don't build it into their life, after 1 month, they will stop doing whatever they're doing. And the more you build it into the life, the more sustainable it will be. Sustainable yoga practice will happen when it's built into the life. Otherwise, it will not happen. The other thing I often tell them is that if you are going to go shopping and the supermarket is, a mile away or, a kilometer or 2 away, why don't you walk there and back? Instead of taking a vehicle, polluting the atmosphere, and not getting the exercise, and of course, the cost involved with the gas prices these days, why don't you walk and go? If you cannot walk, can you take a bicycle? Because walking or the bicycle is going to give you the exercise that is going to help you manage things better. Because if you are overweight, your blood pressure is going to be high, your blood sugar is going to be high. And losing 10 to 20% of your body weight can give you a cure for diabetes and hypertension without medicine. This is amazing. This is why people do bariatric surgery, where they cut out the stomach, a part of the stomach, and people lose tremendous weight. Along with that losing of the weight, they lose the diabetes and hypertension. I know 2 of my friends in Pondicherry who went in for it. And oh my God, when I talk to them, I say, what's the main benefit of all of this? They say, well, I feel good, I feel lighter, which is nice. And they say, now I don't have diabetes and hypertension. Bariatric surgery is curing hypertension and diabetes. Because now that excess weight is not there. Because the excess weight, all that adipose tissue is strangulating your blood vessels, so the hypertension occurs. And all of it is developing insulin resistance, so your sugar goes up. And this is where building the exercise pattern, walking. Then with the walking, what do you do? With the cycling, what do you do? Try to do Sukha Pranayama. Try to do Savitri Pranayama. Try to do Sukha Purvaka Pranayama. When I'm cycling, I do a lot of Sukha Purvaka Pranayama. I went for a 15-kilometer cycle and just got back this evening. That's why I was checking up with Jnanadev whether it is 6:30 or 7:30 Indian time. I thought it was 7:30. I knew the clock had changed, but I wasn't sure what difference it made. So instead of being 3.5 or 4.5, it changes. You have to build it in, and that is where the abhyasa and the jiva karma comes in. The next one is chetana and vacha. What are the quality of your thoughts and your speech? Because when you are talking to the person, and one of the very important skills as a therapist is what is called active listening. And this active listening is not just sitting there, but you let them know that you are interested in what they have to say. And when they finally find someone who's interested to listen to them, they are going to be letting their thoughts out. They are going to be expressing themselves. And that itself is a catharsis that helps most people. So many times I've had that. I've had people come in, and after 45 minutes to 1 hour of a nice long talk with them, they go out, and before going out, they say, that's the best therapy I've ever had. And it's called talk therapy. And the psychologists can make quite a bit of money on talk therapy. If listen to people, it's very, very good. And this active listening. Now, what I always warn my students is, this shouldn't be artificial. Active listening should come out of a deep interest in the other person. It is not just a skill to be developed. Okay. Because many people in psychology, I know young psychologists are taught active listening. And so, they are trying to be in that, but that has to come from the heart. And so as a yoga therapist, it is essential that you are listening to them, not because you have no choice or because they are paying you for it. You are listening to them because you actually care about them as an individual. This has to be fundamental. This has to be fundamental for me. Otherwise, might as well be digging a trench someplace and, moving mud. If you are going to work with people, you have to have a deep interest in other people. And that interest will automatically come the way you maintain eye contact with them, the way you smile, the way you say, yes, okay, can you tell me a bit more about this? And then what happened? This is important, not just a skill that every 5 minutes you look at them and say, okay, and then after 2 minutes you say, what next? It's not a tick box list. It is a skill that has to come by interest, a skill that has to become by a deep interest for humanity. Because the core value of Yoga Chikitsa is a love for humanity. And if you can, yes, Ruby.
Yeah, if I may ask a question there, because I find that sometimes quite tricky. The more you sort of hear and get emotionally involved, it's quite hard to then keep that separate and not hurt oneself as well. So how do you juggle that?
The trick is to develop what is called empathy. And This is a combination. Empathy for me is a combination between the heart and the head. Most people think of empathy as being heart. But then what happens if it's only heart? It is very subjective. And if it is subjective, you will always get burnt because you will identify with the other person. This is where the head part, which is called the vairagya, that non-attachment, has to also be practiced at the same time. It is essential. And this is why empathy is not just a heartful feeling. It is a union of the heart and the head where you feel for the other person, but at the same time, you are maintaining a distance, knowing that it is not you. You are in their shoes, but you know it is their shoes, and you are not. The moment you go into their shoes, you don't become them. This is where the intellectuality has to be guarding you. And as you said, it is very true, because it comes with experience. It comes with experience. But what I often do personally is that I listen with deep interest. I listen with heartfulness. I care about the person. At the same time, I realize I am not them and they are not me. I need to keep this in my head. And this is why often when my patients say, "Doctor, what do you think I should do?" I say, I am not you. You are not me. I cannot make a choice for you. I can give you these options, but you have to make the choice for yourself. And whatever you choose, I will support you in that. This is the communication. Not that you choose and to hell with you. It is you have to make the choice, but whatever be your choice, I will be with you in this journey. I will be a companion, but I cannot make the choice for you. And this is very important. This is where the viveka and the vairagya, the discernment, this is why for this to happen, we as a yoga therapist have to be developing self-reflection constantly. Because a therapist who doesn't have self-reflection will become an emotional imbecile. That's actually what will happen. Because, emotional wreck, then you cannot deal with it. Because I had a interesting one with a lawyer. He was the lawyer who fought our cases in the 80s and the early 90s in the Chennai High Court before we went to the Supreme Court, and saved us. He really saved us at that time. He would be this tiger in the court and not let go of the judge at all. He would just be going on and on and on until the judgment would come. He was amazing. But what had happened with this lawyer is, early in his career, he had identified very strongly with a client and lost the case. So here he had identified with the client, because the lawyers have to say, many times they don't say my client, they say me. They actually have to use language like that at times. It's very, when I used to, as a kid, watch it in court, it used to be very interesting for me. And he had identified so much with his client that when he lost the case, he felt he had lost. He didn't realize it was a case that was lost on merits, but he took it personally. And what happened is, his defense mechanism was to go to the other extent with all other clients after that, where he will tell them, you will not win your case. Most probably you will lose. I'm going to argue it, but I don't think you will win. He went to the opposite extreme. And my mother used to go and sit with him in the office and come back in tears, because he would say, you are going to lose the case. The madam will be taken over. You and Swami Geetananda will be deported from India. He used to be telling like this, and then in the court, he'll go and fight and win the case. Okay, this is what he had developed. Now, that is a total maladaptive response. When I look back at it, lovely man, amazing. We owe so much to him, but an example of maladaptive response. So as a therapist, you need to be in the shoes of the client, understand them from their perspective, but realize it is not you. And that is where the head has to constantly work with the heart. So thank you, Ruby, for that, because this is what I do, but then I've had to think about it intellectually and explain it. So it's nice. Coming back, when we are talking about the Chetana and the Vacha, what are the type of thought patterns the person has? Because the thought patterns are very, very important when you deal with chronic conditions. Because someone who has decided that life is not worth living is not going to live too long. As opposed to someone who says, I am going to fight this and come out of it somehow or the other. There's a big difference. Now, that type of thought pattern is, now again, it's not about, again, in modern pop psychology, you have a lot of be positive all the time. It's a nonsense. That's nonsense. Be positive all the time is nonsense. Be pragmatic all the time is better. There are times to be positive, there are times to be negative, and there are times to be neutral. And try to find out which is the time to be positive, which is the time to be neutral, which is the time to be negative, and be that. That is, pragmatism is important. This whole idea, be positive, be positive. I had a student who, I was talking to him one day, and this is 5-6 years ago. He's much better now, but he had just graduated from our program, and we were talking. He said, I motivate all my patients that they'll get cured by yoga. I'm like, what? I said, have I ever said that in any class that yoga will cure everybody? Have I ever said it? He said, no, but I want to give them positive thoughts and motivate them. I'm like, see, there's a difference between motivation and creating a future disappointment. I say, linguistics is very important. And when people ask me, will yoga help me? What I answer, yes, yoga will definitely help you. You will definitely be in a better place than you are today. I don't guarantee a cure, but what I can guarantee is you are going to feel better, and most probably the situation you are in now, which is dire distress and dukkha, suffering, you are going to come out of it and going to be able to manage your life much better. And depending on the effort you make, along with factors that are beyond our control, well, you may be able to show the world that you are different than others and beat it. You have to be very careful what you say. Your effort, and again, what I tell them is that your effort will bring a result for sure. But if you just sit there, don't do it, and then say yoga doesn't work, I cannot do anything about it. Just because I tell them, because I write it on my piece of paper and give it to you, this piece of paper is not worth anything unless you put it into practice. When you put it into practice, you will be in a better place than you are today. That I guarantee. But I don't guarantee cure. I don't guarantee that you will go off your drugs. You may be able to. You have to be very careful. Create positivity, but don't create, over expectancy that will lead to disappointment later. And what happens by this approach is people will always be happier, because definitely they're going to be so much better, they'll be happy. So it's going to lead to that. But don't start off, because if you say 100% cure, and the person doesn't get 100% and they get 95, they're going to blame you for it. They're going to get to 95 and not be happy about it. And this is why it is very important, and not to say that, no, I don't think you can survive, which is what medical professionals go to the other extreme, the maladaptive thing, where for all we know, you go into the surgery, you may come out dead. Come on, yeah, okay, the chances are there, but not to, you don't put it in that way, but that's what they do. And then the person, you keep on saying them, your chances are 10%, your chances are 10%, and the person dies, and you say, yes, according to statistics, he's died because he's part of that 10%. How much have you contributed to it? How does the person speak? Is it clear? Is it cluttered? Thoughts and speech, are they cluttered? Are they clear? Do they resonate? Are they coherent? Or are they rambling? This is where active listening is where you keep on bringing the person back to the track. I developed a lot of this as a young doctor working in villages. Indian villages where we would go for 3 hours to different villages around this area in a van, and 75, 80 patients I had to consult in that 3 hours. And often you would have these very nice old ladies come, and I would say, what is your problem? They say, this morning I got up at 4 o'clock, and then, I had to cook, and then I went and stood waiting for the bus, but the bus didn't come till 5:15. Then I got on the bus, there was no seat because everybody was, they'll start all the story. I'm asking, what's your problem that's brought you to doctor? They'll start all of that. I initially, for the first few months of my job, I had trouble finishing all my quota for the day. The 75, 80 people who had taken a token. I would be like 25 and the nurse would come, doctor, we only have half an hour for the next 50 people. You learn, that's how you learn the hard way. And then I learned when to, sort of monitor them along. That is part of active listening. You monitor the person along because, you start to find a trend. There's a lot of Sherlock Holmes in this type of work, which is what I like. You have to find the clues and you have to find which clues are useful and follow those clues. And there will all be these red herrings that you don't go. And they don't go onto that track when they start talking about the mother-in-law and daughter-in-law. Those things, then you're there for the rest of the day. Find out what is important. Find out what is really, really, really the source for that person. And this is where, when you listen, you start to get these answers. The answers will pop out of nowhere. And then we come to the ahara, food. Food is always a very big one. Because, that many people, that is what the whole life is about, living to eat. You should eat to live, not live to eat. And what type of food? Because if you are eating junk food, you are going to be junk. That's all. Junk food makes you junk. Healthy food makes you healthy. Full stop. Swamiji's advice on this is very clear. People used to say, can I eat this? Can I eat that? He used to say very clear. He said, eat local, eat seasonal, which is the healthiest possible advice when we talk about food. It's not about whether it's apples or bananas or guavas. It's about what is in season and what is locally available, because that will be healthy and that food will resonate with the local environment where you are living. So your body, because the food which is put into you becomes part of you, you and the local environment will start to have a beautiful symbiotic relationship. Now, they use a term called One Health. One Health, which means that the microbiome that is in us and on us and the biological environment, it is all linked. And so they say One Health. Environmental health and human health are all linked. They call it One Health. It's a nice phrase that is being used more and more these days. When you eat local, when you eat seasonal, you are attuning to the local season, the local temperature, the local mud, the local water, the local minerals, the local vitamins. Amazing what can happen. And this is why, again, Swamiji used to remind us, be careful of the difference between appetite and hunger. Because he said, appetite is psychological. Hunger is physiological. So hunger is when you really need to eat, because your body is hungry, you need to eat. This appetite thing is, I am cycling down the road and I see an advertisement, buy one pizza, get one free. So I stop cycling to go and have 2 pizzas, which I wasn't going to have in the first place. That is appetite. And modern marketing does that. Modern marketing does that. Because they put it in your face. They put it into your mobile phones. Now that I have talked about pizzas, I'm sure tonight all my mobile ads will be about pizzas in Pondicherry. The internet is eavesdropping on me. The rest of it is immaterial. People get stuck. I remember when I asked a diabetologist, I just qualified as a medical doctor and was attending a seminar on diabetology. And I asked a question. I said, what about fruits? Are fruits allowed for diabetes or not? And because, now, today, if you ask me, I would say fruits are definitely the best thing diabetes patients can have. That is actually where I am today. Because just the amount of benefit you can get from a fruit outweighs the glucose in the fruit. This whole thing about fruits, being contradicted is actually, I will tell you frank nonsense, because the sugar in the fruit is immaterial. The goodness in fruits is way beyond anything, and that is going to help that person as a human being for all-round health. But anyway, I asked this question because I wanted a medical answer, and he is one of India's top diabetologists. And the answer he gave me that day, I carry till today. Now, this is, oh my God, long time. This would have been 1999. 1999, I'm talking about this conference. I still remember it, so you can imagine how it impacted me, traumatized me. You know what he said? He said, I don't care what my patient eats as long as they take the insulin. That was the statement from a medical doctor. He said, I don't care. Now, things have changed in the last 2 decades, but that rings in me. I don't care what you eat. You just take the insulin that you need, finished. Today, of course, medical doctors have realized the difficulty. And the biggest problem is because medical training doesn't focus on diet. It just doesn't focus on that. And so I'm not going to talk about carbohydrates, protein, mineral, and vitamin, all that. That is a whole different aspect. But what I'm talking about is, can you look at seasonal, local? Can you look at least 40, if not 50% of your diet? Can it be raw? Now, this becomes difficult with elderly patients who don't have teeth. Then you have to go for smoothies and, juices, and, there's a whole different system there. But for a young person who has the teeth, go for the raw food diet. In fact, some studies today in North America are showing raw food diet, completely 100% raw food, can actually reverse diabetes. That is the extent to which the work is going on. I'm not suggesting that, but I'm saying 40 to 50%, can it be raw? When you cook the food, can that be freshly cooked so that the prana is there? Food that has been put in the fridge and then heated, there's no prana. It's totally aprana. And that is why you may have the best fruit salad and you put it in the fridge and have it next week. There's no prana in there. That satvika fruit salad has become most tamasika. And that is why it's not fruits are satvika. No. Depending on how you eat it. And today the problem with the fruits we get, again, how processed they are, how refrigerated they are, all these issues are there. If you have an apple tree in the back garden, enjoy the apples. Again, local, seasonal, buy it from a local farmer if you can. Because, the chances of it being natural are much more, even if they use preservatives, even if they are not completely organic labeled. It's definitely going to be better than the supermarket. And then Swamiji suggests other things like sprouts. sprouting the grains, sprouting the pulses. Because when you sprout it, you have created what is called, they are biogenic. Swamiji says there are 3 types of foods: biogenic, biostatic, and bioacidic. Biogenic means those that have life energy. Biostatic, where the energy of the life force has actually stopped. So most of the stuff that is refrigerated, you have halted the biological process. And then the bioacidic is stuff that has started to rot, started to decompose. And I would put the processed foods under this, because processed foods are actually very acidic. If you look at the stuff they put into it to keep it from spoiling, there's a lot of acid in it. And that is why, there's a difference between eating fresh food where you don't get a mouth ulcer and processed food all the time where you develop mouth ulcers because of hyperacidity. Bioacidic is that which is breaking down into acid. And when you eat that, you are breaking your body down into an acidic milieu. And the more acidic you are, the more the disease prone you become. Biostatic is sort of just, stopped, but again, no prana. Biogenic. This biogenic, the best one, you could take you pluck an apple off the tree, wash it and eat it, it's biogenic. You take your vegetables out of your backyard garden, clean them, cut them, have a salad, biogenic. But the most biogenic is the sprouted pulses and grains, because they are constantly growing. They're constantly growing. Even as you are chewing them, that is the point where they stop growing. It is as you chew them that they stop growing. Imagine that. Prana right up to the last bite. That is how you should market sprouts. They are filled with prana up to the last bite. And that will stimulate the internal process of restoration, regeneration, rehabilitation. So when you have degenerative conditions, and most of us after the age of 40, we start to degenerate. We grow up to 40 and then we degenerate for the rest of our life. The degenerative process, if you want to combat it, you need to regenerate, and for that you need biogenic foods. That is where sprouts are the best superfood. Now, along with that, viparita buddhi, destructive habits, the negative life styles that people do, the habits that they develop that are self-destroying. Jiva vrittis, what are the body rates of that person? How regular and how fast is the heart beating? What are the breath rate? Is the breath pattern deep, shallow? Is it abdominal, thoracic, clavicular? If it is a woman, please inquire about the menstrual cycle, because a menstrual cycle that is plus or minus 28 days shows that the body systems are in health. When it starts to become much shorter or much longer, it means something is not working in the psychoneuroendocrinology. The mind, the nervous system, and the endocrine system are out of balance. And this is where we start to find those aspects. You can go into deeper aspects of, how much of the right nostril are you breathing, how much of the left nostril, what is called the Swara Yoga, can come under the Jiva Vrittis. Even aspects like what time do you get up in the morning and urinate or defecate? How is your defecation? How is your urination? Can also be, what is the cycle of that? And then the last but not the least, Sankalpa. What are the aspirations and the ideals that the person holds close? Because if the person has an aspiration to come out of the suffering, that Sankalpa will empower them to the Abhyasa the sadhana, and ultimately overcome the suffering. From the dukkha, they can come to sukha. And that is why a sankalpa is not just a wish. It is the aspirational statement. I say sankalpas are aspirational statement where I am going to get better. I will do my best to get better. I will overcome. We shall overcome. We shall overcome. It's a beautiful sankalpa. Martin Luther King, I believe that was. It's an aspirational statement. And that is where, what are the ideals? Where do they feel they can be? What do they feel they can do? And are they willing to put that thought into word and action? Because when you analyze all these 12, you get this multidimensional perspective of the human being. A perspective that is so wonderful that then you can start to realize what are the strengths, what are the weaknesses that this person has. And then what are the opportunities? We do a SWOT analysis. What are the opportunities for them to change? And what are the challenges that may be there, or the threats? Either T or C. SWOT or SWOT, they call it. So to do that SWOT or SWOT analysis, this helps so much because you are not just looking for what is wrong with the person. Please understand. That is why Swamiji says diagnosis and health evaluation. So you could use it even in people who are healthy to understand their strength, weakness, opportunity, and challenges, and to help them in their sadhana. Because if they are healthy, you can practice what is called primary prevention, or rather primordial prevention. And nowadays we used to talk of primary prevention, where you try to prevent it before it happens. Primordial is you prevent it even before the seed for the disease has occurred. That is why teaching yoga to children is a primordial prevention. Teaching healthy lifestyle to young people is a primordial prevention. Don't wait till they start to abuse the drugs to do, screen them, which is primary prevention. Give them immediate treatment, which is secondary, and prevent relapses, which is tertiary prevention. And then, of course, deal with the complications, which is called quaternary prevention. So nowadays we had primary, secondary, tertiary. Now we have primordial before it and quaternary after it. Quaternary is the last one where you're just trying to, salvage what you can. Start with primordial. And that is why this is something that you could use with different people. And I highly recommend that you just find somebody, let them be your guinea pig. And keep on working with them. Keep on asking them, because initially this is very lengthy. It takes a lot of time. So make sure the first 10 people you try like you. Because otherwise you're going to make enemies out of them. Because I've seen our students in the university, and sitting with this for 2 hours, I'm like, that person's never going to come back to the yoga department again. So first do it with people who your friends, your family, somebody who will humor you, or you can say, okay, do this, I'll take you out for a cup of tea and cake or something. Find ways to do it. Because once you have the skill, the time taken will be shorter. And then you will come to a level where most of the time, give me 5-10 minutes with a person and I would give you the 12 what is there already. You'll develop that. You'll start to find these internal shortcuts, and you'll actually start to find it. But initially, you'll have to go through questionnaires and ask them and take a lot of stuff. Any questions? Yanadev?
Oh, I'm just waiting for anyone to say. I think it was really great. I'm glad that the way you sort of concluded it all to pull it together. And I know some of them have done actually few and trying to work with people already with the 12-point system.
It's one of my favorite topics, and because this I don't know whether I should say it to you, but yeah, okay, I'll say it. I started saying, so I'll say it. I actually do it every place. So, I may be sitting in a restaurant and I start to do this. And this is the problem with being a doctor also, is that you start spot diagnosis. It's actually interesting because I am very genuinely interested in human beings. So
Seems like we lost the connection.
yeah, I think the internet just cut out for a moment, which the internet is saying, Dr. Ananda, stop.
Yeah, no, it was really great. Thank you. I think my only, I don't know, maybe a little bit of advice you can give us, because one of the difficulty we will always find in yoga therapy is when we're working with people on the buddhi and the kubuddhi or subuddhi, that like most people we meet at that level are very intentionally intent. Their intent is very strong. They believe in whatever they believe. And I really kind of always have wondered, like, how or where do we start to talk to them about, like, this is not how it is.
This is tough because everybody is a human being.
Yeah.
Everybody has their own perspective. And so, the moment you try to talk about negative tendencies that the person is having that are self-destructive, they don't realize you are attacking the tendency. They think you are attacking them. And this is why I think it is very important to try to communicate clearly. It is like when somebody is addicted to tobacco. When you are saying tobacco is not good and it is causing lung cancer, and, by continuing this habit, you are endangering yourself, your family, and others. It is important to communicate that you are not attacking that person who is using the tobacco, but you're attacking the tobacco habit. I think this distinction is very important because what has happened today in society, and the reason this issue comes, is that we label people very easily. And people who have especially addiction of any kind, often their identity is merged with the addiction. So when you are attacking the substance abuse, they think you're attacking them. When you are trying to work on the substance abuse, they think you are working against them. You're not working against them. And so you have to reiterate to them that we are a team. I love you enough. I care about you enough. I'm interested you enough that I am with you in this battle against this substance that is harming you, this tendency that is spoiling your life. So it is very important to communicate. But it is very difficult, Gyanadev. I 100% accept, because nobody really wants to be told they are wrong. Okay. This is just inherent in our survival defense mechanisms. And so when you say that you have a bad habit, they think you're saying they are bad. You have a bad habit, so you're bad. No, I'm not saying you are bad. I'm saying that habit is a negative habit that is going to cause issues to you. And again, I think here what is important is to give them the perspective of how, if this is not dealt with now, what can happen in the future. And again, communication skills are required, but I do accept very difficult. And each person is a new journey. When it comes to discussing the Viparita Buddhi, there's, every time you start afresh. with each person. Chalo. Yes, Deepa. Yes, Deepa. One last question.
Yeah, thank you so much for nice explanation about it. But one basic question I have is uh, looking at any care center, can we cannot define him as you have this. Uh, we cannot say mental health issue, but we might say it's an obstacle, like you say, viparita buddhi. But how it is to be conveyed to that person? Because
Yeah.
we will be planning the thing same
Yeah.
way, attacking on his mental status only,
Yes.
first of all, right? But how to convey that person? It's very difficult task and a very tricky thing, which we always come across.
What I suggest here is again this one-to-one approach, where you say that in this, see, this comes in the discussion itself. When you are talking about, I'll give an example. Someone is having a substance abuse, because this is one of the commonest issues. So here, to let them know that part of what is happening to them is related to the substance abuse. Part of what is happening to them may be because of the alcohol or the tobacco or a sexual addiction or mobile gaming. That is very difficult to the young people. Today, the biggest issue is the video games for young kids. How do you get them away from it? And it's become a big issue. But there, to let them know that there is an issue that needs to be dealt with, but that we are there to support them in dealing with it. So it has to be brought up, but you don't say that, oh, you smoke, okay, that is why you are like this. You see, the moment you do that, you have lost them. You have lost them, and you have lost that whole opportunity to change, transform, and grow has been. So you say, okay, fine, you have a habit of smoking. How many cigarettes do you smoke per day? How many per week? And do you smoke, at home? Do you realize, if they are married, your wife or your kid, that there are issues with passive smoking causing harm. So, you need to consider this. And if you would like to work on it, I am here for you. I think, this thing, that make them aware of it and say, if you would want to work on it, because if we were to work on it, I feel the outcomes would be better. The problem today that happens most of the time is people say, oh, you are smoking. Oh, how did you develop that habit? Huh? What do you think of yourself? And gone. It's very much the communication. For me, it's very much communication, and you have to learn tact, diplomacy. Diplomacy is very, very important. And again, to tell them, if you want to do pranayama and if you are smoking, it may not be compatible. Because if you're doing pranayama, new parts of your lungs are going to be opened up. And if you smoke, all those new parts are going to get clogged up, and the benefits may not come to you. So while we are doing this yoga therapy, can we try to reduce the number of cigarettes, or can we avoid it for this period, and see how you feel when you don't have it and you do the pranayama instead? You do the relaxation instead. Give them this type of approach. So tact and diplomacy. Okay, then. So nice being with all of you, and hope to see you all again soon.
Namaste.
Have a wonderful time.
Good night.
Good night.